Hi, my name is Vera Mendoza, and I created my poster on maternal mortality. I'm just going to start off here with the introduction. Maternal mortality remains a critical issue in global health. Despite significant progress in awareness of maternal mortality in recent decades, the issue still arises. In many low and middle income countries, maternal mortality rates are unexpectedly high, disproportionately affecting women who lack access to quality health care and adequate resources. The impact of maternal mortality extends beyond the loss of mothers. It affects the overall health and economic stability of communities and nations. To address this issue, it is imperative to focus on improving access to skilled maternal care, addressing socioeconomic disparities, and advocating for women's rights and health equities on a global scale. So the problem here is high maternal mortality rates persist in low and middle income countries, primarily affecting disadvantaged women with limited access to quality health care, thereby exacerbating global health inequities. Some contributing factors to this issue will be limited access to skilled care, socioeconomic disparities, and cultural and gender norms. I'm just going to go in depth with each of those factors. For the first one root cause is the insufficient availability of skilled healthcare providers, particularly in rural and underserved areas of low and middle income countries. Women in these regions often lack access to essential prenatal delivery and postnatal care, contributing to the high maternal mortality rates. Secondly, socioeconomic disparities such as poverty and limited education play a significant factor in maternal mortality. Women in impoverished countries face increased risks due to inadequate nutrition, poor living conditions, and limited access to information about maternal health and family planning. Cultural and gender norms. Deep-rooted cultural norms and gender inequalities can lead to delayed decision-making for seeking healthcare, as well as limited autonomy in reproductive choices. In some societies, women may have restricted access to healthcare resources and may not be empowered to make decisions regarding their own health, including family planning and childbirth. An appropriate intervention would be the antenatal care, or ANC, which is a preventative care provided by skilled healthcare professionals for expecting women to learn about healthy behaviors and to have a prosperous pregnancy. Women are taught healthy habits, warning signs for complications, and childbirth protocols. They also receive support emotionally, socially, and psychologically. For care to be considered ANC, a patient must attend at least 4 visits. The WHO created a recommendation outline booklet as a guide for a smooth pregnancy. This guide includes the 5 sub-interventions, nutritional interventions, maternal and fetal assessments, preventative measures, interventions for common psychological symptoms, and health systems intervention. Each intervention includes symptoms, recommendations, and suggestions for the provider and the patient to follow. Going back to the WHO's booklet, creates a great outline for the patients and the providers. So that booklet will be a pivotal resource to follow throughout the patient's pregnancy and even after the pregnancy. So it'd be a source for the patient and the provider. For the goal, which aligns best with this intervention, would be goal 3, ensure healthy lives and promote well-being at all ages, and aligns with maternal mortality and antenatal care. And then following along, we have cultural considerations and adaptations. Prior to the implementation of ANC, some cultural aspects must be considered. For instance, the diet of the expecting mother. In different countries, states, and regions and communities, pregnant women are told what to eat during different stages of pregnancy. For example, in some divisions of Nigeria, women must avoid snails. In other divisions, they should not consume eggs or milk. And in other regions of the country, women should not eat porcupines. Another aspect to consider is our birthing traditions. Not all deliveries are done at hospitals with doctors, nurses, and other medical staff. It is important for medical providers to be knowledgeable of clients' birthing practices to prepare for the mother's swiftly delivery. Following along, we are at the interprofessional team, which is an essential team of medical providers to promote this program and implement this program. We have OBGYNs responsible for providing comprehensive prenatal care, including counseling, screening for complications, and managing high-risk pregnancies. Next, we have nurse or midwives, provides primary care to women during pregnancy, childbirth, and postpartum, including prenatal education, labor, and delivery support for postpartum care. It was essential to put nurse and midwife due to cultural considerations. Midwives tend to be more available and knowledgeable in the cultural beliefs and practices. And next we have epidemiologists responsible for collecting and analyzing data on ANC utilization, maternal and child health outcomes, and identifying risk factors for poor outcomes. On a global scale, we have partners such as WHO. World Health Organization provides technical assistance and guidance on ANC policies, and program supports that develops of ANC guidelines and tools and promotes the adoption of evidence-based ANC practices. Next, we have United Nations Children's Fund, or UNICEF, supports the implementation of ANC programs in low-income countries, advocates for increased funding for maternal and child health, and works to improve the quality of ANC services. And lastly, we have the community and their role to acknowledge local customs and beliefs and can inform providers and other public health professionals of the practices. Communities can also establish support groups to allow pregnant women to share experiences, seek advice, and provide emotional support to each other. Some ways to evaluate this intervention is satisfaction surveys, long-term follow-ups, and community and provider engagement and participation. For the first one, surveys gather feedback from pregnant women who received ANC services to understand their satisfaction levels, experiences, and perceptions regarding the quality, accessibility, and relevance of the care provided. This helps in tailoring services to meet the needs and preferences of the beneficiaries. 2. Long-term follow-ups, tracking the long-term health outcomes of both mothers and children who participated in the ANC program. And for the community and provider engagement and participation, just assessing the level of the participation and engagement throughout the program for both. I just wanted to end off with a personal statement to express how I feel about this public health issue and intervention. I stand firm in the conviction that every woman, irrespective of geographical location or socioeconomic status, deserves the fundamental right to quality antenatal care. Through collaboration, advocacy, and dedication to bridging healthcare gaps, I aspire to catalyze positive change for the well-being of both mothers and their unborn children.